Good afternoon. Oops. Hi. Hey, everybody. Good afternoon. Yes, this is an afternoon event instead of an evening event, so I have to practice what time of day it is when we're doing this live. It's 2 o'clock on Thursday, November 18th, and today's discussion will be about Medicare Parts A, B, C, and D, changes that you can make to your coverage. And obviously, there's a hint for the fact that this title is so long that there are 4 different parts of Medicare, and some people may only be choosing to participate in certain parts. Just starts the confusion. But before we get into the important topic with our guests, I want to remind everyone that if you are watching on Zoom or Facebook, you are able to turn on a closed caption option. In Zoom, it's a live transcript at the bottom right of your controls. And if you are on Facebook Live, it's also on the right-hand corner, and you can click CC, closed caption, to start viewing. If you're listening by phone, we don't have a closed caption option, but some of you may be on the phone as well. I have a few announcements before we begin the event. We can't not talk about COVID. We just have to keep talking about it so we get it all right. COVID-19 cases, hospitalizations, and fatality rates are starting to increase throughout the US and New York State, unfortunately. Public health officials are very concerned about the possibility of experiencing another surge in rates. The New York City Health Department is advising everyone to protect themselves from possible infection and transmission by using what they're calling a layered approach. This means getting vaccinated, and that can be 1 time, 2 times, or 3 times. This means using masks when you're exposed either at gatherings or in public spaces indoors. It means using tests if you have any symptoms. And a lot of people have sort of gotten out of the pattern of going and getting tested. It's really important that you do get tested if you think you've been exposed or you're feeling like you might be sick for a couple of different reasons. One, if you feel like you've been exposed, we want the city government to be able to know where and when, so that way they can start tracking to try to find the causation. And if you're not feeling great, there are actually medical steps that can be taken to help decrease the level of COVID that you might end up with. So you want to make sure that you are talking to healthcare providers if you do believe you've been exposed. All right, we talked about wearing a mask. We talked about during the holiday season, we're probably going to be spending more time with people in indoor and outdoor settings, and we want to make sure we remember the rules about, in addition to masks, social distancing, and frequent hand washing. It is amazing how many medical experts keep assuring us that one of the most important but easy things we can do is keep washing our hands. All right, it's not that big a deal. We can do it. As mentioned, the layer approach includes getting vaccinated and the booster shots if you are eligible. The New York City Health Department increased access to the booster shot this week by issuing a commissioner's advisory. Now, if you are 18 or older and you received a Johnson & Johnson vaccine at least 2 months ago, or if you received the second dose of the Pfizer or Moderna vaccine at least 6 months ago, you're eligible to get a booster shot. You do not have to get your booster shot at the same vaccination site where you received the initial vaccination series. And for people who don't have any insurance, it's all the costs are covered for you. We will now move on to this afternoon's event, Medicare Part A, B, C, and D changes you can make in coverage. You should know that this event is being recorded, and everyone who is RSVP'd for this afternoon's event will receive an email with a link to the video a couple of days after today, and the event evaluation from the Department for the Aging. We urge everyone to take a few minutes to fill out that survey. Many of you are probably aware that we're in the middle of the Medicare open enrollment period, which runs from October 15th to December 7th. Today, you're going to learn about the changes you can make in your Medicare coverage during the open enrollment period. I am very pleased that Eric Hausman, a consultant with the New York City Department for the Aging Health Insurance Information and Counseling Assistance Program, I'm not saying it again, I will just give you the nickname, HIICAP. So Eric from HIICAP is our presenter today. Eric is extremely knowledgeable about all things Medicare, and we're very fortunate to have him join us. During his presentation, you will also hear about changes coming next year in premium rates and deductibles for Medicare Parts A and B. You'll learn about Original Medicare and the Medicare Advantage plans, Medigap Supplemental plans, and programs that can help defray Medicare costs, including the cost of prescription drugs. I will have to be running to a different meeting. And so after Eric has made his presentation, I'm leaving you in the very capable hands of my Chief of Staff, Brad Usher, who will be moderating the Q&A portion of the event. It is now my pleasure to turn this event over to Eric Hausman. Hi, Eric. Oh, Eric. Oh, good. You're turning on your, great. Okay,
Very
are you
good.
with us? Good, good. Eric, it's yours whenever you want to start.
Okay, that's great. Thank you. Good afternoon. So today I'm going to be presenting about enrollment in Medicare, costs in Medicare, programs that help with those costs, and then most important for this time of year, about choices in the Medicare program. So let's start with Medicare Part B enrollment. Now, for those that are collecting Social Security benefit prior to their entitlement to Medicare, they are automatically enrolled in both Part A and Part B. So if you're collecting Social Security prior to age 65, automatic enrollment in A and B. But a lot of people today are collecting Social Security after 65. Okay? If that's your choice to start then, your enrollment in Medicare will not be automatic. And it'll be up to you to enroll in Part B during one of the Medicare enrollment periods, starting with the initial enrollment period. The initial enrollment period is when people are first eligible for Medicare. It's a 7-month period. For most people, it's the 7 months surrounding the month they turn 65. So the 3 months prior to the month you turn 65, the month you turn 65, the 3 months after that. If you enroll in Medicare Part B in any of the 3 months prior to the month you turn 65, Part B will start the first of the month you turn 65. If you enroll the month you turn 65, Part B will start the first of the following month. But if you enroll in those last 3 months, your Medicare Part B will be delayed. Okay, so if you enroll the month after the month you turn 65, Part B will not start until 2 months later. And if you enroll 2 or 3 months after the month you turn 65, Part B will not start until 3 months later. Now, for the people that are still working or are covered under a spouse, not domestic partner, but a spouse they're still married to at 65 who's still working, especially if they're working for a large employer where the employer insurance would be their primary, their main insurance, they can actually delay enrollment in Medicare Part B. And why would they do that? To save the monthly Part B premium. And if that's your situation and you are covered at 65, again, under your own or your spouse's active current employment, not retiree plan, not Cobra, but active current employment, you can delay Part B and then sign up later using what they call the special enrollment period. The special enrollment period, again, allows you to delay enrollment in Part B without penalty and sign up while you're working or within 8 full months following the month you're no longer covered through active employment. Now, for the people that don't sign up during their initial enrollment period, who don't qualify or maybe miss the special enrollment period and then realize later they need to be enrolled in Part B, they make them wait till an annual period. It's called the general enrollment period. It's every year from January through March. If you sign up during that time, Part B doesn't start right away. It starts that July 1. And these are the people that are subject to the late enrollment penalty. The late enrollment penalty for Part B, it's 10% of that year's standard premium, 10% for every full 12 months you delay. And that 10, 20, 30, 40, 50, 100% or more penalty, it's not one-time penalty. It is a lifetime penalty. So again, the only people that could delay Part B and sign up later using that special enrollment period without having to wait and without paying the penalty are people that are covered at 65, again, under their own or their spouse's, not domestic partner, active current employment, not retiree plan and not Cobra. Now, once you do enroll in Medicare, this is the red, white, and blue Medicare card that you get in the mail, and it shows you the two parts of Medicare. Medicare Part A is your hospital insurance, covers you if you ever need to be admitted to a hospital or a skilled nursing facility. Medicare Part B is your medical insurance, covers you mostly for doctor services, outpatient services to the hospital. So let's talk about the cost in Medicare, starting with the premium. Now, Medicare Part A, most people get that for free, for no premium. As long as you worked, paid into Medicare for at least 40 quarters, 10 years, or you had a spouse that did, Medicare Part A is free. But Medicare Part B, people pay for that. So this year, you see the Medicare Part B premium, actually for 2022, it's going to go up to $170.10 per month. But there are some people that pay a higher premium because they have a higher income. And we're talking about people for 2022 whose incomes are above $91,000 for a single, $182,000 for a married couple. So what they're looking at is what they call your modified adjusted gross income. So that's your adjusted gross income, plus if you have tax-exempt interest income, those two lines on your tax return added together, define the MIGA. And they're looking at that from 2 years prior. So for 2022, they're going to look at your 2020 return. And if your income from 2020 was above that threshold, you're going to get a notice late this year to let you know you'll be paying a higher Part B premium for next year as a result. Now, the good news is if you're paying a higher premium 1 year based on income, it doesn't necessarily mean that they'll be forever, because every year they automatically reassess it. So for 2023, they're going to look at your 2021 return. And if your income goes below the threshold for that year, you'll go back to paying the standard premium for that year. Because a lot of times people that we see that pay that high premium 1 year, they're not people that have high incomes in retirement. But what happened was when they looked back 2 years ago, their situation was different 2 years ago. They were still working at that time. Well, if you have what Social Security calls a life-changing event, a change in your marital status, more likely a change in your work status, you may be able to successfully appeal that higher Part B premium. So as an example, we had a couple who last year, their income was very high because they both worked. But this year, their income was much less because they both stopped working. So I said, look out, the end of this year, you're going to get a notice. You're going to have to pay a higher premium for 2022 based on your 2020 return. You should then contact Social Security and tell them you had a life-changing event because you stopped working. And instead of basing your premium for next year on 2020, like they will by default, you want them to base it on a more recent 2021 tax year. And as a result, they're going to save significantly on their Part B premium for 2022. And then you'll see in the third column for people that pay a higher Part B premium based on their income, if they also have a Part D drug plan, they pay an additional surcharge for that coverage as well based on their income. It's paid in the same way as the Part B premium. If you're collecting Social Security, it's taken out of your check. If not, it's billed to you directly. Now, besides a monthly premium for Part B, there's an annual deductible. That next year, it's going to be $233. So that means the first $233 in covered medical expenses, that's going to be your responsibility, unless you have other insurance to pay that. Once you meet the deductible, Medicare generally pays 80% of what they allow. You're responsible for the other 20%, the Medicare co-insurance. Now, it's different for lab tests and for most preventive services, including the flu vaccine and the COVID vaccine. Those are covered at 100% by Medicare. But most everything is subject to the annual deductible plus the 20% co-insurance, whether it's an office visit or surgery or mental health or physical therapy or another service. But to really understand your responsibility under Part B, you need to understand about the concept of assignment. And this is an important term for Medicare, assignment. So what does it mean when a doctor accepts Medicare's assignment on a claim? Well, when they do, that means they agree to accept whatever Medicare allows as their full payment. And then what do you pay? Any unmet portion of that $233 deductible next year, plus the 20% coinsurance. Now, in the United States, most doctors sign a participation agreement with Medicare. And these participating doctors have to accept assignment 100% of the time on all claims for all people with Medicare. But there are some doctors who don't sign that participation agreement. They're non-participating. And they actually have a choice on your claim to accept assignment or not. And if you ever see one of these non-participating doctors and they don't accept assignment on your claim, they're not allowed to just charge whatever they want or just the usual fee. The federal government limits doctors who do not accept assignment to charging no more than 15% above what Medicare allows. That's the federal, what they call limiting charge. And then there are a third category of doctors that have opted out of Medicare. And when they do, it's for at least a 2-year period. And during that time, they cannot bill Medicare, and Medicare does not pay at all for these doctors. And they're not in the Medicare program. So they're not limited to what Medicare allows, limiting charge. They're able to bill and collect up to their usual fee. And again, Medicare will pay no part of their services. So far today, I've been speaking about one way to get your Medicare, original traditional Medicare, and we spoke about Medicare Part B medical insurance. But there's also very significant cost sharing involved for Part A for hospitalization. Although most everybody gets Part A for no premium, there's a large deductible if you need to be admitted to the hospital. So next year, for a hospital admission of up to 60 days, Medicare will pay everything but the deductible. You see, it's $1,556. If you're in the hospital beyond 60 days, for the 61st through the 90th day in the hospital, you're responsible for a daily copayment. Next year, $389, and that's per day for those additional 30 hospital days. If you're in the hospital beyond 90 days, Medicare allows an additional 60, what they call lifetime reserve days, which you can use once during the lifetime of your Medicare coverage in any combination. But once you've used them, that's it. They're non-renewable. For those 60 lifetime reserve days next year, you're responsible for a daily copayment, $778. And again, that's per day for those additional 60 hospital days. If you are discharged from the hospital, a skilled nursing facility for rehab care, Medicare will pay the first 20 days there in full. The next 80 days, you're responsible for a daily copayment. Next year, $194.50. And again, that's per day for days 21 through 100 in a skilled nursing facility. And these Part A benefits, they're not a calendar year benefit like Medicare Part B. Part B is fairly simple. Next year, you have one deductible, $233. Once you've met it, that's it. You're done for the year. But the Part A deductible, somebody may have to meet that more than once in the same calendar year because it's once per what they call a benefit period. And the key to understanding Part A is to know how the benefit periods run. A benefit period begins the very first day you're admitted to the hospital, and it ends when you've been out of the hospital, out of the skilled nursing facility for a period of at least 60 consecutive days, at which point your benefits renew. They start again. So for instance, let's say you have to be admitted to the hospital in January for 5 days. Medicare will pay everything but the deductible, $1,556. But what if in February you need to be readmitted to the hospital or a different hospital? Same condition, different condition, doesn't matter. Less than 60 days have gone by since your discharge. You're still in the same benefit period. You just pick up where you left off at day number 6 of your first 60 days of coverage. You don't have to meet a new deductible. You don't. What about instead of being readmitted in February, what if you were admitted 3, 4, 5, 6 months later? Still the same calendar year. It's still 2022, but now it's a new benefit period. More than 60 days have gone by since you were discharged. Your benefits renew. They start again. You're back to day number 1 of your first 60 days of coverage. And you have to meet a new deductible, $1,556. So I hope this slide will help to point out the importance of people having other insurance besides Medicare. Because for people that have Medicare only, you could see they could wind up paying a lot out of pocket, especially for hospitalization. And when I talk later about Medigap, Medicare Supplement insurance, You'll see how that fills in very nicely here. And that's a big reason why someone would purchase a Medigap plan. And then there are some services that are just not covered at all under original traditional Medicare. These are the more common ones, including dental care. They don't cover a routine vision exam or eyeglasses. One exception, they'll pay for one pair following cataract surgery. Otherwise, they don't cover eyeglasses. Medicare does not cover hearing aids. And important to know, Medicare does not cover long-term care. Medicare covers what you saw on the last slide, short-term rehab care in a skilled nursing facility, okay? Not long-term care. Also, Medicare does not cover a routine annual physical exam. Okay, they cover a more limited annual wellness visit you may have seen in the Medicare literature, but a comprehensive head-to-toe annual physical exam has never been a covered benefit under original traditional Medicare. Medicare also does not cover services outside of the United States and its territories, like Puerto Rico or the U.S. Virgin Islands. So if you're traveling outside the United States and its territories, even in the event of an emergency, Medicare will not cover those services at all. So we spoke about original traditional Medicare, Part A hospital insurance, Part B medical insurance. For those in original Medicare, if they want drug coverage, they need to purchase a separate standalone Part D drug plan. This year, they have in New York 28 of those plans to choose from. Next year, they're going to have 19. And those 19 plans each have their own formulary, their own list of covered drugs. So not every one of the 19 plans necessarily covers all of your medications. And they have their own network of participating pharmacies. So the pharmacy that you like, maybe they don't take all 19 plans. How do you compare? You have so many plans. You have to go to the Medicare website, medicare.gov, where they have this comparison plan finder search tool, where if you enter the names of your drugs, not just the names, but the dosage, the strength, the quantity you take each month, and then select your pharmacy, that search tool will compare all 19 plans and rank them based on your individual needs, from least to most expensive. If you're not comfortable using the website, you can call Medicare, 1-800-MEDICARE, 24/7. They'll do that for you over the phone. If you want local assistance, that's our program, the HIICAP program. And if you find there's a better plan for you for next year, the time to sign up is now, during the annual election period, every year from October 15th to December 7th. If you do, your new plan starts January 1. What do these plans cost? Well, first of all, they have a monthly premium. The average premium is about $30 to $50, but they have one plan that costs less than $8. Another plan's over $100. So there's a range. Besides a premium, there's an annual deductible. Next year, that's $480. Some plans have a $480 deductible. Some have a lesser deductible. Some have zero. $480 is the most it could be next year. Once you meet the deductible, people usually pay a fixed copayment at the pharmacy until they get to what they call the coverage gap, the donut hole. That begins at the point next year that they reach $4,430 in total drug cost. Regardless of how much you paid up to that point, doesn't matter. When the total cost of your drugs gets to $4,430, now you're in the coverage gap. At that point, you pay 25% of the cost of the drugs out of pocket until, for people with very high drug costs, they may reach what they call catastrophic coverage. That begins next year at the point that you reach $7,050 in what they call TROOP. TROOP is the acronym, true out-of-pocket cost. What does that include? Everything you pay, not the premium, everything you pay at the pharmacy, deductible, copay, co-insurance, the 25% during the gap. Plus, there's one thing you don't pay, but luckily still counts towards that amount. And that is for brand name drugs that you get during the gap. You're paying 25%, but what you don't see is of the other 75%, 70% of that, most of that cost is a drug manufacturer rebate. Even though you don't pay it, it still counts towards that $7,050. And that's good for you because that gets you out of the coverage gap and to the catastrophic coverage for many people next year without having to pay nearly $7,000 out of their pocket. And then once you get to the catastrophic coverage, your drug costs go down, where you pay no more than 5% of the cost of the drugs or a small copayment. That's how the plans are structured. But in order for this to be really meaningful for you, you have to go to the website or have somebody go there for you to do a comparison to see what the cost would be for your drugs in your pharmacy not just once, but every year in the fall when the information becomes available for the next year. So we've talked so far about the cost of Medicare, and now I want to talk next about programs that help with those costs, starting with what they call extra help, or the low income subsidy, LIS. This is a subsidy the government provides to help people with their Medicare Part D drug costs. Some people get it automatically. The people that do are the people that have either Medicaid in addition to Medicare, and or the Medicare savings programs where the state pays their Part B premium. Automatically, they get full extra help with Part D, which means they can get a subsidy that'll pay their entire Part D plan premium. So they get a Part D plan for nothing and only small copayments for their drugs at the pharmacy. If you're not on Medicaid and you're not on a Medicare savings program, but you have limited income and limited resources, you won't get this assistance automatically, but you may be able to apply to get, if not the full subsidy, at least a partial subsidy. The place you'd apply to is Social Security, best done on their website, ssa.gov. You need to have an income less than 150% of the federal poverty level. So this year we're talking up to $1,630 a month for a single person, and limited resources as well, up to $14,790 for a single. If your income and resources are above those amounts, you may not qualify for this program, but you may still qualify for EPIC. EPIC is New York State's pharmaceutical assistance program. It's for New York State residents that are 65 and over that have incomes up to $75,000 for a single, $100,000 for a married couple. EPIC does not work on its own. EPIC only works as a supplement to your Part D plan. And it works with every Part D plan, where Part D is your primary, your main insurance. EPIC wraps around. EPIC helps to fill in the gaps in coverage. But there's one gap that EPIC will not help with, and that is your Part D plan deductible, which we said could be up to $480 next year. EPIC's not paying that. But once you meet the deductible, EPIC can help lower your copayments. EPIC can help you during the coverage gap. EPIC can help you with the catastrophic coverage where you're paying 5%. But for some people, 5%, it's a couple of $100 for really expensive medications. With EPIC, the maximum copay you pay, $20. And what does EPIC cost? For most people, it's free. So if you're single, you had an income between $20,000 and $75,000 last year, as many people did, you would be in EPIC's deductible plan. You won't pay anything for EPIC, but you'll meet a deductible on a sliding scale based on your income before EPIC will pay for your drugs. And in addition, EPIC members are also entitled to a special enrollment period where they can change their Part D plan, including Medicare Advantage plans with Part D, one time per year, in addition to this annual period, October 15th to December 7th. So for some people, it's worth it to join EPIC just to be able to change plans without having to wait till the next year. And if you're not an EPIC member already, you can sign up anytime for EPIC. Cannot do it online. You have to do it via paper application, which you'll mail or fax to EPIC. And then the last of the programs that help with the Medicare costs, it's called the Medicare Savings Program. This program pays the Medicare Part B premium, okay, for those that qualify and apply. There are actually 3 Medicare savings programs. Let's look at the one at the bottom, the QI. The income limits for that go up to $1,469 a month for a single, $1,980 a month for a couple. That program not only pays the Part B premium, but like all the Medicare savings programs, it actually makes you automatically eligible for full extra help with Medicare Part D, which we said before can pay your Part D plan premium and reduce your copayments to small copayments at the pharmacy. So people can apply for these benefits at any time that they may be eligible. A couple of advantages to living in New York State with the Medicare Savings Program. First of all, they only look at your income. So like EPIC, they're not concerned about your assets or resources, only income to qualify. On top of that, even if your income's a little too high, you may still qualify. Because if you're paying privately for health insurance, you can actually deduct your health insurance premium from your income to be eligible for this program. So you cannot deduct the Part B premium because this program pays the Part B premium, but other premiums you can, such as a Medigap premium, which we'll talk about coming up, long-term care insurance premiums, which can be very expensive. Sometimes people's income's only slightly above the limit. $5, $10, $15. For them, it might be worth it to buy some cheap dental policy or vision policy for $20 or $25 a month just to have that deduction. Because again, once they qualify, the state will pay the Part B premium for them, and it will make them automatically eligible for full extra help with Part D. So far today, we spoke about one way to get your Medicare: original, traditional, fee-for-service, straight, regular Medicare, Part A hospital insurance, Part B medical insurance, and about the gaps in coverage, deductible, co-insurance. Now let's talk about filling in the gaps. Some people have retiree health insurance that fills in all or most of the gaps in Medicare. Other people have Medicaid in addition to Medicare, in which case Medicaid can do that. But today, most people don't have retiree health insurance, and most people don't qualify for Medicaid. So what do? They might purchase a private Medigap, a Medicare Supplement plan. You may have seen them advertised on TV from AARP. Medigap plans are identified by letter. There are 10 standard plans ranging from plan letter A to plan letter N as in Nancy. All of these Medigap plans cover certain things. They all cover you for days 61 through 90 in the hospital. That this year, 371 per day. They all cover the 60 lifetime reserve days. This year, $742 per day. Plus, if you exhaust your Part A benefits, they'll all cover you for an additional 365 days of inpatient care. Most Medigap plans pay the Part A deductible, the hospital deductible. Most Medigap plans pay the entire 20% Part B coinsurance. And then other benefits vary from plan to plan. But let me tell you the two most important things to know about Medigap insurance. One is that the benefits are standard. Okay, so different companies sell these plans and they charge different amounts. But as long as it's the same letter plan, doesn't matter what they're charging. It's exactly the same coverage, exactly the same. So it's well worth your while to shop around for the best deal on a Medigap plan. And that's essential for you to know when you're looking for Medigap insurance. It's a standard benefit. Again, the same letter plan provides exactly the same coverage no matter who you buy it from. The other thing that's really important in New York State, unlike most states, we have continuous open enrollment for Medigap. And that means as long as you have Part A and Part B, it doesn't matter if you're over 65 or you're disabled with Medicare under 65, you could purchase a Medigap plan anytime at all. They can't limit you to only enrolling at certain times of the year or when you're first eligible, not in New York State. However, although you can buy a plan at any time, you may be subject to a waiting period for pre-existing conditions of up to 6 months, which most but not all the insurers have. So again, what that means is, although they'll sell you a plan whenever you want, if you live in New York State, they may not cover a service related to a pre-existing medical condition for up to that first 6 months. However, again, most people we meet are able to avoid the waiting period because they've had some sort of prior credible coverage. And that could be most anything. It could be another Medigap plan, a Medicare Advantage plan we'll talk about next, employer plan, retiree plan, Cobra, plan through the marketplace, the VA for veterans. As long as there's no break in coverage or a short break of less than 63 days from when that ends and the Medigap plan begins, they'll credit the time with the prior coverage towards meeting the waiting period. So for instance, if there's somebody on the phone today that's been on a Medicare Advantage plan all year, but January 1st, you're going to switch to original Medicare with the Medigap, you don't have to worry about pre-existing conditions. They will credit the year you're with the Medicare Advantage plan towards satisfying that waiting period. And then if you want to see which companies offer which Medigap plans, how much they cost, along with the waiting periods, this is the website for the New York State Department of Financial Services, where you can see the current information as well as information for January. And then I want to tell you about a change that happened with Medigap Insurance. So this is a chart of the 10 standard plans, A through N, and you'll notice there are 2 plans, C and F, that cover the Part B deductible. That's that $233 deductible next year that I mentioned earlier. Those are the most comprehensive plans. But the change that happened last year is that people that are new to Medicare, beginning 2020 or later, do not have the right to purchase those plans. They can purchase D or G, which is the same plan, it just doesn't cover the deductible, but not C or F. However, if you were somebody that was eligible for Medicare prior to 2020, like say you turned 65 in 2017 or 18, even if you didn't take Part B right away because maybe you were still working or you're covered and your spouse is still working, that doesn't matter. As long as you were eligible for Medicare prior to 2020, you can get Plan C or Plan F when you get Part B now or in the future. It's just the new people to Medicare cannot get those plans. Okay. So whenever I talk to somebody just becoming 65 this year, I'll talk to them about Plan G instead, because that's the most comprehensive plan they can buy. But it can be expensive. If they're looking for a lower cost Medigap plan, I would then talk to them about Plan N. If you notice, when you move from G to N, there are two differences. First of all, Plan N does not cover the Part B excess. You know what that is? That's for those doctors who don't accept assignment. That's the additional up to 15% above what Medicare allows. G covers that excess, N doesn't. But most every claim doctor accepts assignment anyway, and they can't charge the excess. That's a small difference. The big difference with Plan N is for office visits. Instead of covering the entire 20% Part B coinsurance, like Plan G and most plans do, for office visits with Plan N, you have a copayment of up to $20. And the reason they say up to $20 is if the 20% is less than $20, you just pay the 20%, but no more than $20. And that's just for office visits. That's not for your physical therapy or your anesthesia or your surgery, your radiology, your ambulance trip. Plan N pays the whole 20% for those services. It's just for office visits where you have up to a $20 copayment with N. And that's how they're able to offer that plan at a little lower premium. But if you're looking for the lowest premium plan possible, that's the high deductible version of Plan F and Plan G. You'll notice that F and G have an asterisk next to them. That's because there's a second version, covers everything the standard F or G covers, but before they pay anything, you have to meet a deductible. This year, the deductible is $2,370. Next year, it's going up to $2,490. So because you have to pay the first $2,370 in Medicare cost sharing out of pocket this year, they're able to offer those plans at a much lower premium. And if you want to see which plans are offered, this is a chart that we updated as of last month to show you in the greater New York City area a complete listing of all the Medigap insurers, all the plans they offer, and exactly how much they cost per month. Just note that for Empire, Blue Cross, and Blue Shield, although these rates are the current rates for them, starting in January, they will have higher rates for their Medigap plans. And if you want to see those rates, and throughout the year to make sure you're looking at the most current information, you should be going to the Department of Financial Services website again, where we also included a link to that here as well, dfs.ny.gov. So far we spoke about one way to get your Medicare, original traditional Medicare, Part A hospital insurance, Part B medical insurance, and that might come along with the Medigap or Medicare Supplement plan. This is the other way to get your Medicare, to join a Medicare Advantage plan, a Medicare Health plan. This is Part C of Medicare. Nobody calls it Part C, though. It's at Medicare Advantage. And these are private plans. They're contracted with the government to provide all of your Medicare benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that accept that plan. These are the companies that send you so much mail every day, right? Whether it's Aetna, or Bright Health, or Centers Plan, or Elder Plan, or Emblem, or Empire, or Fidelis, or Health First, or Humana, or Metro Plus, or United Healthcare, or VNS Choice, WellCare. Many companies offer those plans. And most everybody's eligible to join. All you need is to have Part A and Part B of Medicare, and you need to live in the service area of the plan. That's it. But unlike Medigap Insurance, which we said if you live in New York State, you can purchase a plan at any time or switch from one insurer to another at any time. For Medicare Advantage, for most people with Medicare, there are only certain times of the year that they're able to enroll or switch plans. And of course, we're in one of those times right now. So first of all, you can enroll in a Medicare Advantage plan when you're first eligible and enrolled in Medicare Part A and Part B. If you don't, or maybe you did, but now you don't like the plan, you want to switch, most people have to wait till the annual election period. That's every year from October 15th to December 7th. If you sign up for a plan between October 15th and December 7th, your new plan starts January 1. If you realize at the beginning of the year that you want to make a change, there's another enrollment period. It's called the open enrollment period. So every year from January through March, anybody that's on a Medicare Advantage plan has one additional opportunity to switch to either another Medicare Advantage plan or to original traditional Medicare, one time between January and March to be effective the first of the following month. After March, for most people, whatever plan they're on, if they're on a plan at all, that's what they're going to have for the rest of the year. And then it's important to remember, if you join one of these plans, you're not giving up your Medicare benefits. These private plans are required to cover whatever Medicare covers. Plus, as an incentive to join, they will cover to a limited extent some services Medicare does not pay for. So, for instance, they may provide limited coverage towards things like dental, towards vision, eyeglasses, towards a hearing aid. They probably pay for that routine physical that Medicare doesn't. They might pay for a gym membership for you, all things not covered by Medicare. But what I think is the biggest incentive, especially in our area, is that plans may be available for as low as no premium. I bet you've seen them advertised, 0 premium. You're still going to pay that Part B premium. Okay, they're saying 0 additional premium. Plus, they include the Part D drug coverage. Okay, some of them as low as no premium. And that could be a very powerful incentive, I would say, for somebody that maybe doesn't have retiree coverage, that doesn't have Medicaid, that cannot afford or doesn't want to pay $200 more a month for the average Medigap plan. You may be very tempted to join a 0 premium Medicare Advantage plan instead. But even if the plan has no premium, that doesn't mean the plan has no cost for you. And it's going to cost you on the other end when you access care, usually in the form of a copayment. So when you go to the doctor, some plans have no copayments for primary care doctors, but they all do for specialists, some as high as $50. If you're admitted to the hospital, plans usually have a daily copayment up to a maximum out of pocket. So for instance, you might have a daily copayment $200, $300, $400 a day, up to a maximum number of days, 3, 5, 7 days in the hospital. If you need something like durable medical equipment, you might not pay a copayment, a fixed dollar amount. You might have co-insurance, a percentage as high as 20%. But so the bottom line is, with Medicare Advantage plans, for most services under most plans, it's not 100% coverage. And you're going to pay something at the end of the day, copayment or co-insurance. But in fairness to the plans, it's not an unlimited amount that you're responsible for the year. All Medicare Advantage plans have a maximum out-of-pocket limit, abbreviated MOOP, MOOP, not to exceed this year and again next year, $7,550 in network or $11,300 combined in and out of network with the PPO type plan. So if you have a plan with the $7,550 limit and you get physical therapy, it's a $40 copayment. The $40 is applied to the $7,550. If you're admitted to the hospital and they have a $300 daily copayment for the first 3 days in the hospital, the $900 into your pocket goes towards the $7,550. And if you reach that limit, most people won't. But if you do, 100% coverage for the rest of the year for all Part A and Part B covered services. Most plans in our area have these very highest limits that are allowed, but there are some plans that have lower limits. And that's something you may want to compare when you're looking at different Medicare Advantage plans for 2022. Something else to compare, certainly, is the type of Medicare Advantage plan. In our area, most plans are HMO plans, where with an HMO plan, unless it's an emergency, you're limited to doctors and hospitals that participate, that accept that plan. If you go outside of their network, you're going to wind up paying the cost out of pocket. But there are a couple of companies that have HMO plans with a point of service option, HMO-POS. They allow you to go out of network, but it's a limited out of network benefit. So for instance, they don't necessarily cover all services out of network. They may have a limited dollar benefit amount out of network. They may require prior authorization out of network, But whatever they did give you, it's a little more flexibility than does the HMO. But if you're looking for a little more choice and flexibility still in your Medicare Advantage product, you might consider instead a PPO, Preferred Provider Organization plan. Like the HMO, they also have a network of doctors and hospitals. And if you use their providers, you'll pay whatever copayment the plan has. The big difference with the PPO, you can go outside of their network to doctors and hospitals that take Medicare, not opt out of Medicare, take Medicare, but just don't accept this particular plan. And you'll pay more when you do, and you might have to pay up front and then seek reimbursement from the plan. But for that reason, you have more choice, more flexibility than does the stricter with the PPO than it does with the stricter HMO plan. And whichever plan you decide, whichever Medicare Advantage type plan here you decide on, if you want prescription drug coverage, remember it's included with your Medicare Advantage plan. Because if you go with the Medicare Advantage plan, you're getting all of your Medicare benefits, Part A hospital, Part B medical, Part D drug, all from the same plan. So let's just take a few minutes to compare. For those people on the phone today that do not have retiree coverage, that do not have Medicaid, here are your two choices. It's either original Medicare with the Medigap plan, or it's a Medicare Advantage plan. It's one or the other. Now, why would you decide on original Medicare with the Medigap plan? It gives you the most choice of providers. You can go to any hospital across the country, they all take Medicare, as do most doctors. And depending on the Medigap plan, it can be pretty complete coverage between the two. But what's the downside of original Medicare with the Medigap plan? High premium for the Medigap plan, plus it doesn't cover your prescription drugs. So you'll need to buy a separate Part D plan for another premium. So the people on the left here, they pay 3 premiums every month. One for Part B, they're going to pay anyway, a second for the Medigap plan, a third for the Part D drug plan. So they pay the most in premiums, but in exchange, the most choice of providers across the country, the most complete coverage. So what about the other choice instead, Medicare Advantage? Why would you choose that? You save on those premiums. Some plans are available for as low as no premium, and it includes the drug coverage. So you don't need a separate Medigap, you don't need a separate Part D, you're saving on that end. Plus, you're getting some limited extras that Medicare doesn't, dental, vision, hearing, the gym membership. But what's the downside? If it's an HMO especially, unless it's an emergency, you're limited to doctors and hospitals that are participating. And we said earlier, even if you don't pay a premium, you pay when you access care. Co-payment or co-insurance for most services under most plans, up to a maximum out of pocket for the year. Plus, this is managed care. So although they do cover your mental health and your physical therapy and your planned surgery, you may need to get pre-approval, prior authorization before those services will be covered. So for some people, it makes more sense to have original Medicare with the Medigap plan. Other people do very well with the Medicare Advantage plan. If you want to see all of the available Medicare Advantage plans with the details of the plans, you can go to the Medicare.gov website, the same place you to compare your Part D drug plans. And if you do that, you might find, depending on where you live, that you have 40 or more Medicare Advantage plans to choose from. You couldn't possibly compare every single plan that's out there. So I always tell people, if you're interested in Medicare Advantage, start with your doctors. If you have a doctor or doctors you're committed to that you're not be willing to switch, like many people with Medicare do, ask which Medicare Advantage plans they participate in. I bet they don't take every plan or have even heard of every plan. That amongst the 3, 4, 5 plans they do take, compare those plans on the Medicare website to see how they cover your drugs at your pharmacy, because your drug costs can vary from one plan to another. And that's the way to make a good informed decision about which, if any, Medicare Advantage plan is right for you. And then in this last section, I want to talk about a big change that's going on for New York City retirees, people that are retired from the Board of Ed, from a New York City agency, right, that have health insurance and have Medicare. The big change is for New York City retirees, they are being automatically switched to a new plan. It's the NYC Medicare Advantage Plus plan. So unless they actively opt out Okay? They will have that plan for January 1. Now, the opt-out period was originally set to expire the end of October, but because of a lawsuit, it's now been extended and it's now ongoing. So people can still opt out today. If they do opt out, it will be in order to remain with their current plan that they have now. Currently, many New York City retirees have the senior care plan, as it's known. This works as a supplement to original Medicare. It's comparable to the Medigap plans we were speaking about earlier. It does not cover the Part B deductible, plus they have their own $50 deductible. But once you meet those deductibles, it picks up the 20% coinsurance. Currently, the senior care is no premium for New York City retirees. Starting next year, it's the new plan, the NYC Medicare Advantage Plus plan, which will be the zero premium option. People that opt out to remain with the senior care will have a new premium next year. It's going to be $191.57 per month per individual, and another $2.83 for a hospital rider that most everyone with that plan has. And it will not be as comprehensive as it is today. Instead of paying the entire 20%, as the senior care does now, next year they'll have new copays, for instance, for specialists of $15 to match the copays that people will have with the NYC Medicare Advantage Plus plan. Now, other New York City retirees don't have the senior care. Some of them have the old HIP VIP plan. That's no premium, and it's going to continue to be zero premium for New York City retirees next year. But if they want to remain in that plan, they must opt out of the NYC Medicare Advantage Plus plan. Because again, if they don't opt out, that's what they're going to have for next year. So let's highlight some of the features of the NYC Medicare Advantage Plus plan. It's a PPO plan. So like any PPO plan, you can use any Medicare provider throughout the United States. And like any PPO plan, if you use an out-of-network providers, they pay actually the same rates that Medicare would pay for those providers. But what happens is if your provider is in network, it's much easier for you because you just pay the copayment at the time of service. If they're out of network, although the PPO plan can cover them, chances are you'll have to pay upfront up to that limiting charge if they don't accept assignment. And then you might have to seek reimbursement from the plan. And if the provider is not willing to bill the plan, it's possible that you might have to send in your own claim to the plan for that reimbursement. They have the same cost sharing with the PPO plan, the new plan in or out of network. There's a $253 deductible next year, $15 copayments for specialists and many other services, $300 inpatient hospital stay. That's the same as the senior care is going to have next year. And the new plan has a very low maximum out-of-pocket limit, $1,470, and that's combined in and out of network for Part A and Part B services. Plus, they give you some additional benefits too, like transportation and silver sneakers, which is a gym membership benefit. And then what about the drug coverage? Well, some New York City retirees get their drug coverage through their union, the welfare fund, along with other benefits like dental or vision. That's not changing here. But there are other New York City retirees that purchase a rider for their drug coverage from Emblem for about $100 to $150 a month currently. That's the same rider people are going to have with the new NYC Medicare Advantage Plus plan. Okay, so whether you opt out to keep your rider with the senior care or you go with the new plan, it's the same rider, the same drug coverage, and it's going to be $125 a month, the same cost. Other New York City retirees have a separate standalone Part D drug plan from SilverScript or Humana or AARP, one of those. Those you have to watch out for because if they are moved to the new NYC Medicare Advantage Plus plan, you can't have a Medicare Advantage plan at the same time as a standalone Part D plan. So as a result, they're going to lose their Part D plan, okay, if they're enrolled in the new plan. And if they want drug coverage, they have to actively enroll and purchase that prescription drug rider, because if not, they can start the new year without having drug coverage at all. And then the good news is there's going to be an annual transfer period. So historically, New York City retirees were able to change every other year, but now they'd be able to switch each year in the fall. So for instance, if you go with the new plan in the fall of next year, you could always opt out to go back to what you have currently for 2023, or the other way around too. If you opt out for next year and you stay with your current plan, and then you decide you want to try out the new plan, you can do that in the fall of next year, and you'll have that for January 2023. So it's not a lifetime decision that you're making, whatever you decide for 2022. And the good news also is that New York City retirees are entitled to reimbursement of the Part B premium, including the higher Irma Part B premium that we spoke about earlier. That will continue regardless of whether they go with the new plan or they opt out to remain with the current plan. However they get their New York City retiree coverage, they are still entitled to this Part B premium reimbursement. So that's the information I have for you today. I'm happy to answer any questions in the next section. And remember, anybody that has any questions could always call us in the HIICAP program, and they'll share a phone number, and our counselors can help you with any questions, including questions on the new NYC Medicare Advantage Plus plan. Thank you.
Thank you so much, Eric. That was really great. And just to let everybody know, I'm Brad Usher, Senator Krueger's Chief of Staff. For anyone who came in late, Senator Krueger was double booked, so she had to leave this one, and I will be doing the moderating of the questions. Thank you, Eric, for a wonderful and very detailed and informative presentation. We will be sending this presentation to everybody who was registered for the event along with the slides. So if there's a lot of information, you can go back and look at it afterwards. We have a ton of questions. Fortunately, a lot of them were covered in one way or another in the presentation, not surprisingly. But I will go through, and there may be a little bit of repeat as I try to combine questions in a way that makes them new, and try to get through as many of these as possible. So a lot of the questions are sort of how to navigate what's the best for me. Here's one that I'll start as an example. For people who have had original Medicare and a supplemental Medigap plan for years, should they make any changes?
Well, that's a big question. I mean, you can certainly keep the Medigap plan, and Medigap plans are what they call guaranteed renewable. So as long as you keep paying the premium, you continue to have that same plan from the same insurer, indefinitely, even if they stop selling it to new people. But I think to make a good decision, you would also want to compare, other Medigap plans that are available and other insurers, along with the Medicare Advantage plans. And the way people usually will compare the Medicare Advantage plans is to start by asking their doctor or doctors which, if any, plans they participate in.
Great. You talked about trying to figure out which drugs are covered by a particular plan as you make your decisions about drug coverage. But one person raises the issue that it seems like a crystal ball is required to make a decision about a coming year's RX requirements. Any clues about figuring out our future drug needs other than the drugs you need now? So in other words,
right,
people's needs change.
Right. So yeah, the way I would say it is that you can only compare the plans based on your current medications that you're taking now. However, the plans, whatever plan you decide to join, they all cover drugs for any condition that you may have or that you may develop in the future. Okay, so you're protected on that end. And even though the plans have a formulary and they don't cover every drug for every condition, okay, if you run into that situation where you have a new drug in the future that your plan doesn't cover, now is the time you're able to work with your doctor to see if the doctor could prescribe something else that the plan will cover. Because again, every plan covers drugs for any condition, or if not, with the doctor's help to request an appeal, an exception, where if the doctor can prove to the plan that that's the one drug necessary for you, the plan would have to cover it at least through the end of the year, at which point you could always switch to another plan for the following year. So you do have those protections. I understand it's not entirely predictable, but you are protected, whatever Part D plan you choose to join.
Great. Okay, a couple of Medigap questions. You think you answered a lot of the stuff here. Why do insurers charge different prices for plans if they're the same?
Yeah, so that's a big question. The state, they get approval from New York State for the Department of Financial Services for rates, and some insurers feel they can sell the same policy for a lower rate. Other insurers, based on their experience, feel they need to charge more for that policy. But you, as the consumer, you just really need to know that if it's the same letter plan, it's exactly the same coverage. So so most people that buy a Medigap plan, they will buy the plan knowing that from the insurer that offers it at the lowest rate.
I think this was largely answered, but just to make sure that folks got this one, is there a penalty when not buying a Medigap policy within the first 6 months of turning 65? If I sign up for a Medigap policy years after enrolling in Medicare without a health review and possible denial, so I guess can you be denied?
Right. So when you're talking about a 6-month period, you might have read that in federal Medicare publications like the Medicare New Handbook. They refer to that as an open enrollment period. That's very important if you live in most states, like in New Jersey, when you turn 65. Because in New Jersey, during that first 6 months, insurers are not able to deny you coverage. But after that first 6 months, they may ask you medical questions, they apply underwriting, and they might decide they don't want to sell you a policy. But in New York State, that doesn't apply, because in New York State, it's always open enrollment. And you can always buy a Medigap plan, okay, regardless of your age, regardless of your health. Okay, but just remember, although you can do that at any time, you may be subject to a waiting period for pre-existing conditions of up to 6 months if you have not had other credible coverage, I should say, from another source, okay, besides Medicare itself. So if you are purchasing a Medigap plan for the first time when you're in your 80s and haven't had other insurance besides Part A and Part B, you're going to be subject to that waiting period. But here, although most insurers like AARP and Empire have a 6-month waiting period, there are a couple of insurers that have shorter waiting periods. So here's the one reason why you may want to pay more to have a Medigap policy is if you're subject to the waiting period and you want to get a plan from an insurer that has a shorter waiting period in order to get coverage for pre-existing conditions sooner. And then you know what? After 6 months, you could switch to AARP or Empire and save some money. That's the way to do things if you live in New York State.
Got it. And there's a number of Medigap questions about which one is the best one and this particular plan versus that. I took it. I learned from your thing that it depends, and you should probably go through the pluses and minuses of different cost levels.
Right. So usually I'll start, with the most comprehensive plan, like we spoke about today, that you can buy, and then work down from there. So that might be Plan G if you're somebody new to Medicare, and then if you're looking for something cheaper, you might consider Plan N. And if you're looking for the lowest cost plan, maybe one of those high deductible plans where you have to pay more out of pocket initially in Medicare cost sharing at the beginning of the year. But as a result, you're able to save on the premium over the course of the year.
Okay. Going on to Medicare Advantage, a number of questions about the pluses and minuses of each. And I think there's a great slide you should look at in that presentation that I think explains that pretty well. So under straight Medicare, this might just require some clarification, but under straight Medicare, what are the out-of-pocket expenses associated with doctor visits, specialist visits, physical therapy? My mother currently pays $50 per visit under Medicare Advantage, and I'm considering switching her coverage to regular Medicare.
Okay, so if you have regular Medicare only, for Medicare Part B, there's that annual deductible, $233 next year. And for most services, including services you mentioned, there's 20% coinsurance. But that's a percentage. You don't know exactly what that's going to cost you. Okay. So because of that uncertainty, people may want to purchase the Medigap plan, the Medicare Supplement plan. And there, whatever the 20% is, you're not concerned about that because the Medigap plan is paying that for you.
Great. turning to prescription drug coverage. I am on Health First 65 plus plan HMO, which does not cover some medications, and I have had a lot of co-payments. Would I be better switching to an extra Medicare plan? I gather they're talking about, I'm not sure whether they're talking about Medigap or Medicare Advantage. But.
Well, for anybody that has Medicare Part D, whether it's through a Medicare Advantage plan like this person does, or original Medicare with a separate Part D plan, those are things you might run across, and issues with the coverage, where it might not be as complete as what you're looking for, or it might not have all of your drugs on the formulary. If the case is that you have high cost sharing with your plan, you want to think about the programs that I spoke about that help with those costs, the Extra Help, the EPIC, the Medicare Savings Programs, if you're eligible for those programs. If you have issues where the drugs are not on the formulary, then again, you may want to think about switching to a plan that has all your drugs on the formulary, right? And that is participating with your pharmacy. But if you're switching your Medicare Advantage plan, remember, you're switching all of your coverage, not just the drugs, but the doctor and hospital too. So you have to make sure that your new plan also meets those needs.
Okay. When you switch, so you talked about preconditions if you switch to Medicare Advantage or Medigap. Somebody's asking if they're switching from to traditional Medicare after being on Medicare Advantage, do precondition protections still apply?
Right. So if you're switching from a Medicare Advantage plan to original Medicare with a Medigap plan, okay, with let's say no break in between or just a short break, then they will credit the time you're with the Medicare Advantage plan towards meeting the Medigap waiting period. So like in the example I gave of somebody that was on a Medicare Advantage plan all year, but January 1st, they're going to have original Medicare with the Medigap. That year they were on the Medicare Advantage plan satisfies the 6-month waiting period for pre-existing conditions with the Medigap Insurance.
Okay, and some questions about changing back and forth plans. And I think your information on the various open enrollment periods and tells you when you can do that. If you're not happy with your initial selection, you can change.
Right. So if you want to move, for instance, from a Medicare Advantage plan to original Medicare, you can do that twice a year, October 15th to December 7th, and again between January and March. If you want to go the other way around, right, from original to a Medicare Advantage plan, now's the time to make that, okay, for January 1st.
And the other second part of the question is, if I do nothing, do my existing selections stay the same? Yes.
Yes, as long as your existing plans will still be available in the next year. Okay, and that's true. So as long as your plan will be available, if you do nothing, you'll remain in that plan, as you said, for the next year.
Okay. I'm going to throw what is more of a policy question at you, which you may or may not have an opinion on or an explanation. And if you don't, you can just say that. Can you discuss the surcharge placed on Medicare premium and drug premiums if your income exceeds a certain level? What is the reason the governor makes you pay extra for drugs in Part D when you have a separate drug plan with high copays as well as a supplemental Medicare plan for copays?
They changed the law. At one time, everyone, paid the same Medicare Part B premium, regardless of their income. But they had changed the law where they reduced the subsidy for people with higher incomes. So as you may know, the standard Medicare Part B premium represents 25% of the cost of Medicare Part B. So people pay 25%, the government subsidizes the other 75%. And then the change was for people with higher incomes, they reduced that subsidy. So people at the very highest income levels, instead of subsidizing 75%, they only subsidize 15% of the cost. And that's why their Medicare Part B cost over $500 a month. Okay. As far as the Part D, initially when they had Part D, people just paid the premium for their Part D plan that they chose. Okay. But then they changed the law again to add an additional surcharge for their Part D drug coverage as well. Because again, Part D is something that also the government subsidizes the cost, and then they reduce the subsidy for those with higher incomes. So that's what I would say there as far as the surcharge.
Okay, I've got one question here that is specific, but probably might help clarify some other things. My current Medicare Advantage plan, former employer base, has completely covered injectable chemotherapy drugs during the past, but in 2022 will change to the customer paying 20% for the drugs. I'm considering opting out to acquire a Medicare Supplement Plan F. Does that plan cover injectable chemotherapy? And then there might be the issue of whether they can get in Plan F based on that going away, but maybe because they were on an employer paid, they can.
Yeah, right. So first of all, for people that are considering giving up their retiree health insurance, the first thing I would say to them is check with your former employer to see if you do give that up, will that be permanent? Okay, for many people it would be permanent, but for other people they may be able to get it back if they change their mind in the future. You would also want to find out if you're giving up retiree coverage, health insurance coverage, are you giving up other benefits as well? Dental, vision, other benefits by giving up your retiree coverage. So those are important questions to ask for anybody that's thinking about giving up retiree coverage. If you if you do give up your retiree coverage, okay, you would have original Medicare by default, Part A and Part B. And if you were eligible for Medicare prior to 2020, so if you turned 65 before 2020, when you're on original Medicare and you don't have your retiree coverage, you could actually purchase Plan F. And Plan F is the most comprehensive plan that's available for sale. And it covers completely between original Medicare A and B and Plan F, 100% for your Medicare covered hospital and Part B services.
And it would cover injectable chemotherapy. Is there a specific question? Is that?
Yeah, so as long as that's being covered under Medicare Part B,
okay,
then that would be complete coverage between that. Because the idea is that with Plan F, it covers the entire Medicare cost sharing, Part A and Part B cost sharing.
This question I don't fully understand, but maybe you will. How does the 5% max over fee work in New York? I'm guessing that's the 515 thing.
Yes. So right. So we didn't talk about that, but we spoke about the federal limiting charge. This is for doctors that don't accept assignment. We said they can bill up to 15% above what Medicare allows. But some states, including New York State, have a lesser limiting charge. So in New York State, we have a 5% limiting charge that applies to most physician services. But there's an exception here, and that's for office visits. So for office visits, for a physician, even though the services are done in New York State, if they don't accept assignment, they can bill up to the 15% federal limiting charge for office visits. But for most physician services, again, if they don't accept assignment and the services are done in New York State, they can bill no more than 5% above what Medicare allows. Because again, that's the lesser limiting charge protection we have in New York for most physician services.
And a question that we get a lot in the office that I'm not sure you might have thoughts about what's causing this, but doctors are rejecting Medicare patients. I've been dismissed after 8 years because I will not pay him $3,000 a year. We hear a lot about people, the difficulty of Medicare patients getting doctors. Is that?
Yeah, so when you talk about a $3,000 charge, what it sounds like is the person's referring to what they might refer to as a concierge fee, where these providers are in Medicare. They haven't opted out of Medicare, but they have an additional charge, whether it's $500 or $1,000 or $2,000 or $3,000, just to be part of their practice. Okay, and that doesn't, Medicare allows them to do that because if they're not charging for a specific service, okay, Medicare, they can just charge, they can have that additional charge. And if they do, and you want to remain with them, they're going to ask you to pay that amount. But you could always use any Medicare provider, and there are many Medicare providers in our area in every specialty. And you can find them either on the Medicare.gov website or 24/7 on the phone with 1-800-Medicare in case you're running into a situation where they have that concierge fee that you do not want to be paying for that. If the doctor, though, is just opted out of Medicare, which is the other situation you may run into, which we see more certainly in Manhattan and anywhere else, okay, there, just remember that Medicare is paying no part of this provider's services, and you would be responsible for up to their usual fee. Medicare does not limit them as to how much they can charge because they're not part of the Medicare program.
Okay, that's, we see this with, in areas that have relatively high incomes. We have doctors who don't accept any insurance. I mean, that's one thing that we've discovered in our district, which certainly would not be true in other parts of the city or other areas where there aren't people who can pay out of pocket. Back to an employer-based question. I'm over 65 and my job is being eliminated. Can I sign up for Medicare Part B supplemental G plus supplemental G plan as well as Cobra my company is offering?
Okay, so that's asking a lot there. So,
Okay.
so we have to kind of break it down. So if the person's been covered under their active employment since the month they turned 65, right? And they are now past that 7-month initial enrollment period surrounding when they turn 65, they're entitled to a special enrollment period, which will allow them to sign up for Medicare Part B, without having to wait and without paying a penalty. Once they do enroll in Medicare Part B, they can purchase a Medigap or Medicare Supplement plan. If they live in New York State, they can always purchase that plan. Okay, and they'll credit the time that they had the employer coverage towards meeting the Medigap waiting period. Now, as far as Cobra, okay, once you stop working, your former employer would need to offer you Cobra. But when you're on Cobra, it's not based on your active employment. So Medicare would be your primary, your main insurance. So the most important thing is enroll in A and B. Some people would prefer to have the Cobra as a second insurance, especially if the former employer is subsidizing the Cobra as part of some sort of severance package, for instance. But if you don't have the Cobra, then you may want to purchase the Medigap insurance. And the other part is the drug coverage. If you have Medicare and a Medigap, you'd have to purchase a separate Part D plan. But if your Cobra includes the drug coverage, okay, then you may not want to do that for as long as you have the Cobra. But the problem we see with Cobra is that sometimes people will have Cobra and not sign up for Part B. And that's a big, big problem because, again, when you're on Cobra, it's not coverage through active employment. So Medicare is primary. So it does not extend the time you have to enroll in Medicare. And remember, when you're on Cobra, because Medicare is primary, if you don't take Medicare right away, the Cobra insurer may not want to pay, okay, if you don't have Medicare. And you can understand why, because if you took Medicare, the government would pay most of the cost. So those are big, big problems we see with people that have Cobra that don't take Medicare right away, Part B.
Return to a couple of questions that came in today. If your income dropped in 2021, do you have to have filed your taxes for 2021 to appeal for a lower rate?
Yeah, so what happens is this refers to the IRMA, the higher Part B premium. So we said for 2022, it's going to be based by default on your 2020 return, right? So you're going to get a notice the end of this year to say what your premium will be for next year from Social Security based on the 2020 return. If your income went down this year because you stopped working or reduced your work, like in the example that I gave earlier, you would have to notify Social Security, okay, about that and ask them to base your premium on the more recent 2021 tax year. If you do that prior to filing your tax return, okay, once you do file your tax return, you'll need to provide that information to Social Security as further proof of that your income is reduced. Okay, also, I would recommend Social Security has a form for people that want to make this kind of appeal. It's a SSA 4444. You can download that from the Social Security website. And it talks about life-changing events. So it tells you what qualifies as a life-changing event, like this example, and to explain the issue. And if you use the form, this way you'll be sure that you're giving Social Security all the information that's needed for that appeal.
This is one I certainly see all the time. There are mailings, TV ads, and social media ads trying to get us to phone up in for free, no obligation reviews of our Medicare plan and to save money. It is totally unclear who the sender is. Is the sender Medicare, marketing agencies, or brokers?
Right. Well, not Medicare themselves. Okay.
Right.
So it is for brokers, that sell these Medicare products. They are advertising so that you contact them and give them permission for you to speak with them. Okay. And some people like the ideas of using brokers because brokers will look at their situation and they'll recommend a particular plan. Because we're happy to do counseling for you, and we at HIICAP, we will help you to compare plans. But what we won't do is we won't recommend a plan for you, okay, or a particular option. So some people prefer going to the broker because, again, they will make that recommendation for them and say, I think based on your situation, I would say go with this plan for next year. Okay. Other people use both. They use the broker and then they'll call us and say, is this right, what they're telling me? We're happy to do that too.
That sounds like a good idea to me because I certainly get the sense that some of these folks are selling one thing as opposed to giving you that they're really going to give you options, but maybe I'm overly cynical. I don't. A question. Can you speak to the penalties that people can incur if they sign up late for Medicare Part A, B, and D? I think you answered this, but this came in during the questions today, so I think maybe a review.
So the late enrollment penalty. So first of all, for Medicare Part A hospital insurance, if you qualify for premium-free Part A, as most people do, you can apply at any time without penalty. Okay. For Medicare Part B medical insurance, you can only delay enrollment in Part B, like we were speaking about earlier, if you are covered through active employment or a spouse's active employment. If not, and you delay enrollment in Part B, the penalty is 10% of that year's standard premium for every full 12 months you delay. And it's based on a percentage of that year's standard premium. So this next year it'll be a percentage of that 170 and change, okay, times the number of full 12-month periods that you delayed. And it's a lifetime penalty as well. For Medicare Part D, okay, if you do not enroll in Medicare Part D drug coverage when you're first eligible, and you do not have other what they call creditable drug coverage from another source, like a former employer, like the VA for veterans, and you do not qualify for extra help with Part D, then you would have a penalty for that as well if you sign up later. That penalty is calculated at 1% of a national average times the number of months you delay. So to give you an idea, that national average this year and again next year is $33 and change. So 1% of that, about 33 cents, times the number of months you delay. That's the Part D late enrollment penalty, and that's also a lifetime penalty.
I think I got time to squeeze one last question in. I received notification of a refund due to Medicare, quote, no longer deducting prescription drug coverage income-related monthly adjustment amount from monthly benefits, unquote. What is this about? Do you know?
Well, that sounds like, we were talking earlier about the IRMA, the higher Part B premium for people with higher incomes. And we said that if you also have Part D drug coverage, you pay an additional surcharge for that as well. So that person may at some point have stopped paying the higher surcharge for the Medicare Part B, and as a result, also for the Part D. And or maybe they just no longer have the Part D drug coverage. And if you don't have Part D drug coverage, you're not subject to a surcharge for that.
Okay. Well, I want to really thank you, Eric Hausman, for joining us. But once again, your wealth of information and I know this event was very well attended and lots of people were very interested in this. Our next event will take place on Wednesday, December 8th from 7 p.m. to 8:30 p.m., which is a bystander training for high school students. We did one for adults a while back. Students, their parents, or caregivers are welcome to attend the training, which will help young people develop safe strategies to stand up for their peers and to encourage them to treat each other respectfully. Finally, a reminder, with temperatures dropping and the holidays approaching, it is important to get tested for COVID-19. If you develop symptoms, you are exposed to somebody with the coronavirus, or you are going to participate in holiday gatherings, even if you are vaccinated. Get a booster shot. If you are over 18, I did. And it's been more than 2 months since you received your Johnson & Johnson vaccination, or 6 months since you received the second dose of your Moderna or the Pfizer vaccine. Thank you all for participating today, and happy Thanksgiving.